You're watching Let's Chat.
Coming up in March, it is Colorectal Cancer Awareness Month, and this is a disease which is so easily detectable and easily treated. We are going to be spending a few moments now talking with Dr. Sean Rice, who is a gastroenterologist with Erlanger Health System. Dr. Rice, good morning.
Good morning. How are you?
Doing very well, sir. Easily detectable and easily treatable, correct?
That's correct. Colon cancer is, like you said, it's very common. It is actually one of the third leading causes of cancer-related death in the United States, and really just requires a few simple tests to detect it. And it can be detected early and treated and cured in most individuals.
At what point should we begin getting screened for colorectal cancer?
Yeah, so that's a great question. Traditionally, we've been screening all individuals in the United States at age 50, but there has been some recent data and some of our screening guidelines have been coming into question and maybe moving it back a few years to age 45.
Right.
So the American Cancer Society actually has recommended age 45 as well as the USPSTF. Some of the GI societies have not adjusted those recommendations. So we're probably finding right now that between 45 and 50 is reasonable. 45 has actually been the recommendation for quite some time for all African Americans. Mm-hmm. So that has not changed, but for the remainder of individuals, 45 or 50 is probably where we're going to start screening.
Who should be screened first? I know everybody should be, but if you had to pick out the ideal candidate, the ideal demographic, who's at the top of the list?
People that particularly are high risk are individuals that you're looking at with family histories. So family histories of cancers or family histories of advanced polyps. So knowing your family history really can target whether you need to be coming in and seeing your gastroenterologist or at least your primary care doctor.
What screening tests are available?
Yeah.
Which one do you find to be the most reliable?
So with a little bit of acknowledged bias as a gastroenterologist, but the reality is the best single test is a colonoscopy. Mm-hmm. And the reason for that is it has the highest, the statistical terms we use are sensitivity and specificity, meaning that there's the best test for detecting colon cancers and non-cancerous adenomas. But we have found that there are other tests that are non-invasive, that are stool tests. One of them is called the FIT test, or the fecal immunochemical test.
Right.
And then the other one, which is the FIT test that's combined with a fecal DNA test, that's one that you see on TV now. It's called Cologuard. Mm-hmm. And the way we think about these tests is that there's tiers. The tier one that we consider is the better test that we should probably be using is colonoscopy, which in my opinion is the best test.
Right.
And that is at least every 10 years, starting at 45 to 50, like we talked about. The FIT test is the other tier one category. Mm-hmm. That's a stool test every year. So that's an annual test.
And we are all adults here, and we know the importance of getting tested and getting tested regularly. A lot of times, folks of a certain age think, I had that done once 10 years ago, I'm good. That is not the case. You are not good. You do need to keep getting tested repeatedly over the years, and getting ready for this test is not as bad as it was just a few years ago.
Yeah, the reserve from patients is, and the hardest part of the test actually is the bowel preparation itself. And so now we've come up with a multitude of different bowel preparations. I mean, there's not really an easy way to clean out the contents of your colon, but that is the most important thing. I can't stress that enough. The most important part of a colonoscopy is the quality of bowel preparation. But there has been
your health, and potentially it could be your life, either yours or someone who is in your family that you love very much. Dr. Sean Rice, we got to leave it there. Thanks so much for joining us.
Absolutely.
You've heard just a few of the reasons why you and other members of your family need to get screened. And of course, March is Colorectal Cancer Awareness Month. Find out more by checking out the Erlanger website. It is erlanger.org, erlanger.org.